At Oticon, we have a simple goal. That is to create a better future for every child with hearing loss. In order to meet that goal at Oticon, we focus on creating the very best technologies we can to meet the needs of these hearing impaired children. These technologies need to be fully individualized to the needs of each and every child on your caseload. Further, these solutions need to be safe and robust to keep up with the busy lives that children lead. We are proud to be able to partner with you to come up with solutions that you can confidently recommend to the parents of the children on your caseload. At Oticon, we have a specific philosophy about providing amplification to the hearing impaired child. We want to make full use of all the hearing that the child has. We don't believe in abandoning certain frequency regions just because the child might not have usable hearing in the higher frequencies. Rather, we believe that we want to use the full bandwidth that the child brings until we have evidence that the child simply cannot use that hearing effectively and it does not contribute to the child's overall performance or perception. We have a specific focus on providing effective audibility, especially in the mid and high frequencies. First starting with Safari and now continuing with Sensei in its third generation dynamic feedback cancellation system, we believe that we can do a good job of extending the response of a hearing aid out past 4 kHz. In fact, we believe that we can meet DSL targets for moderate speech inputs out to 6 kHz and beyond for most hearing losses that you'll see. Why do we have such a specific focus about extending the bandwidth of hearing aids? Well, first of all, it's about speech audibility, of course. We want to make sure that as many of those softer high-frequency consonants are audible as possible. But more importantly, it's about providing effective communication abilities for a child, especially in complex listening environments. The better the response in the high frequencies, the more likely the child will be able to use natural localization skills. If the child can use these natural localization skills, the child has a better chance of organizing all the sounds in the environment and then deciding which ones are most relevant and which ones should be paid attention to. Further, we all recognize how important incidental learning is for the child. The better able we are to represent the high frequencies in the hearing aid, the better opportunity it is for the child to hear all the sounds in the environment. As that child is developing, that awareness of what creates sound, where those sounds come from, and most importantly, what those sounds mean, are very, very important for that developing child. An alternative approach that has been talked about in recent years for providing amplification to children with hearing loss is frequency lowering. We believe that frequency lowering is simply not consistent with our philosophy of trying to use the full bandwidth of the child's hearing to the greatest degree possible. Certainly, frequency lowering has its place. But we believe that far too many clinicians jump to frequency lowering as a solution before they verify that the child cannot actually use high-frequency hearing effectively. We believe that the best place to start is to try to effectively use the full bandwidth of the hearing that the child brings to the task, and only move to frequency lowering when it's clear that the child can't make use of the high frequencies in a natural manner. What are our concerns with frequency lowering? Well, first of all, we believe it represents a doubling up of the processing burden in the mid-frequencies. Although the thresholds in the mid-frequencies are better than in the high frequencies, we still believe that there's going to be some signal processing limitations in those mid-frequencies. If that's the case, then you're now asking a compromised system to have to process twice as much information. Frequency lowering should never be used as an alternative for a hearing aid that does not have a good frequency response naturally, or it has a weak DFC system. Over the last few years, several different independent research groups have been looking into frequency lowering as a treatment technique for children with hearing loss. The results of that work simply cannot be used to support the notion that frequency lowering technology should be a widespread solution for any child with sensorineural hearing loss. Are there some children for whom frequency lowering technologies make sense? Of course there are. For example, a child who's undergoing cancer treatment with a strong drug like cisplatin and who ends up with a true cliff audiogram would certainly benefit from moving the high frequencies down to a more audible lower and mid-frequency region. Also, there are some patients with profound hearing loss who are not yet using cochlear implants where frequency lowering may be beneficial in those cases. But for the most part, we believe the vast majority of children with hearing loss can be best served with a broadband, natural, speech-focused response in the hearing aid. Our goal is to create a better future for every child with hearing loss. And we believe that that future is grounded on making full use of the hearing that the child has. It's a daunting task when parents ask you to recommend technologies that make best sense for their child. At Oticon, we offer you an alternative. We offer you an alternative that is a natural, broad-based approach to the speech signal that tries to use the child's hearing to the fullest degree possible. We appreciate the opportunity to partner with you in reaching the important goals of creating a better life for every child that you see. Thank you.